Hello everyone. Welcome back to another episode of Dental Digest with the Study Boards. This is Dr. Trehan and today we will be exploring another type of odontogenic cyst known as eruption cyst. So let's get started. Now we are going to break down everything about eruption cysts step by step. And first we are going to look into its origin and etiology followed by their clinical features. Then we are going to discuss how they appear radiographically, what's their histopathology reveals, and then the complications that may arise. And finally, we will cover their differential diagnosis and treatment. Let's talk about origin and etiology of eruption cysts first. Now, these cysts are basically a soft tissue version of dentigerous cysts, and they are considered as developmental cysts. So what happens here is that during the eruption process, the dental follicle, it doesn't completely separate from the crown of the tooth. And because of this incomplete separation, fluid or sometimes even blood, it gets trapped, forming a cyst over the crown. And you will commonly see this in young children when their decidus or permanent teeth are erupting. Let's talk about the clinical features now. Now, eruption cysts are quite distinct when it comes to the clinical presentation. They typically appear as a dome-shaped, soft and compressible swelling. And they are most commonly present on the alveolar ridge of the children. And these cysts are usually painless, and they rather have a bluish or you can say translucent appearance due to the fluid trapped inside. Now, a key characteristic is when the cystic cavity it contains blood. And in such cases, the swelling takes on a purple or you can say a deep blue hue, which is why it is known as eruption hematoma as well. Let's talk about the radiographical findings now. Eruption cysts are unique in that they are usually diagnosed clinically rather than radiographically. And this is because they form entirely in the soft tissues without any involvement in the underlying bone. But radiographs can still play a role. While the cyst itself won't appear on an X-ray, a radiograph can confirm the presence of an unerupted tooth beneath the swelling. And this can especially be very helpful if the cyst persists longer than the expected or if there are concerns about delayed tooth eruption. Now let's take a closer look at the histopathology of the eruption cysts. Microscopically, these cysts are lined by non-keratinized stratified squamous epithelium, which is a characteristic of this lesion. And inside the cyst, the lumen typically contains a clear serous fluid. But in cases where there has been some bleeding into the cyst, the fluid may appear blood-tinged. Now let's talk about the complications. Now, eruption cysts are generally self-limiting, which means that they tend to resolve naturally as the tooth erupts through the gingiva. But there are some cases where they can lead to delay in the eruption of the tooth, especially if the cyst is large or it persists for a longer duration. Now, in rare situations, a secondary infection might even occur. When this happens, it can cause pain or discomfort, and then an intervention can be needed to manage these symptoms. Now, let's talk about the differential diagnosis. Now, when we are diagnosing eruption cyst, it is very important to distinguish it from other similar lesions like Epstein pearls, Bohn's nodules, mucocele, and hemangiomas. Now let's talk about how to differentiate it from Epstein pearls. Now, Epstein pearls, they are small, white, cystic lesions commonly found on the midline of the hard palate in the newborns. But in contrast, the eruption cysts are going to be found on the alveolar ridge. Next, if we have to talk about Bohn's nodules are tiny, white, keratin-filled cysts which are located on the buccal and lingual aspects of the dental ridges in newborns. But in case of eruption cysts, they are going to have a bluish hue and they are present in the place of an unerupted tooth. And when we are talking about mucocele, it is another condition to consider because it is going to appear as a soft bluish swelling which is caused by mucus retention. And now mucoceles, they are typically found on lower lip, whereas the eruption cyst is going to be commonly found on the alveolar ridge. Lastly, hemangiomas, on the other hand, are vascular lesions that appear red or bluish purple. But the key feature of hemangiomas is that they blanch when you apply some pressure, and that is something eruption cysts do not do. Now let's discuss the treatment options for eruption cysts. So most of the eruption cysts don't really need any intervention. Now as the tooth erupts, the cyst usually resolves on its own. However, there are some instances where the treatment becomes necessary. And if the cyst is causing pain, bleeding, infection, or there is an aesthetic concern even, a minor surgical procedure may be needed to resolve this. Now in such cases, a simple incision or you can say a partial excision of the overlying tissue can help us expose the crown of the tooth, allowing it to erupt properly. Now a common technique used is marsupialization. This involves removing the dome of the cyst to create an opening, which makes it easier for the tooth to erupt. Now let's wrap up with some key points from today's discussion on eruption cysts. Eruption cysts are developmental odontogenic cysts that form in the soft tissue overlying an erupting tooth. And these are most commonly observed in children during the eruption phase of both deciduous and permanent teeth. Clinically, they appear as dome-shaped, bluish, or translucent swellings on the alveolar ridge. They are usually painless, but they can occasionally become tender, and especially if they are infected or when blood accumulates, they can form an eruption hematoma. Radiographically, these cysts don't involve bone, so diagnosis is primarily clinical. But the x rays can confirm the presence of an underlying erupting tooth. The complications are rare, and most of the cysts they resolve spontaneously. But rarely we can also see delayed tooth eruption, or secondary infections may also arise in some cases. Finally, it is crucial for you to differentiate these from other conditions like Epstein pearls, Bohn's nodules, mucoceles, hemangiomas through clinical examination and the patient history. And when it comes to the treatment, majority of the eruption cysts, as we talked about, don't require any intervention and they rupture on their own, allowing the tooth to erupt naturally. And if complications arise, a simple surgical procedure like marsupialization can help you. Thank you so much for watching this episode. Now, if you found this video helpful, give it thumbs up and subscribe to the channel for more content. Let me know your thoughts or questions in the comments below. I would love to hear from you. Remember to keep working hard and keep rocking. I'll see you in the next one.